we know that we already there had been an established company and which sell a particular medicine. But if a company copies that same packing and all, same packing, same method of writing, same color variants, that is considered as spurious text. So it is spurious imitation. So if a company imitate certain other companies packing and all, it is known as spurious text. If it is sold, offered, exhibited, or sold in the name which belongs to another drug, so that is known as spurious drug. Okay. Then next one is, so these are the three important sections of misbranded drugs, adulterated drugs, spurious drugs. So adulteration is done by adulteration is when the drug is mixed with the filthy, putrid, and decomposed substances. Misbranded is if it is colored, coated, polished, or thereby the damage is concealed. That is known as misbranded. Adulteration is added, the drug has been added with the substandard quality drugs, and the spurious drug is the drug has been copied. Uh, the spurious imitation. The drug is sold or exhibited in a name which belongs to another company. So that is known as spurious drugs. Next one is we have learned about the government analyst. So we know that the central government or a state government by notification in official gazette appoint such persons having prescribed qualifications to be government analyst. So the government analyst means the person who are responsible for to do the test or analysis of the samples. So that has been the person has been appointed by the central government, and there is a section which is and the qualification of government analyst is explained in a drug and cosmetic rule. This is a section which mentions the government analyst, which has been and the provision also. No person with the financial interest should not be appointed as a government analyst. That actually implies to inspectors also. Okay. Next one is 33I, that is penalty for manufacture, sale of Ayurveda, Siddha, Unani drugs in contravention of this. Like we have mentioned, that is 33E misbranded, 33EE adulteration, or 33EE A is spurious drugs. So the person is punishable with imprisonment for a term which may extend to 1 year, with fine which shall not less than 20,000 rupees. So the person is punishable with the imprisonment of 1 year and a fine of 20,000 rupees. So those penalties, the penalties of each sections has been explained in 33I, section 33I. Okay. So next we will move on to the sections or the provisions which relates to manufacture of Ayurveda, Siddha and Unani drugs in drugs and cosmetic rule. So the first, the part 16 is the from the part 16 to 19, the provisions of manufacture of Ayurveda, Siddha and Unani medicines are described in detail. And the first part is part 16. So the first provision is rule number 151, manufacture on more than one set of premises. So we know that if a company or a pharmacy is setting up, and they will apply for a license. So if the pharmacy or the manufacturing company has a branch, is starting a branch, then they should apply for a second license. So a separate application shall be made. A separate license shall be obtained for each premises. So that has been explained in rule number 151. Manufacture on more than one set of premises. So they have to apply for the license again, and they have to get a license separately. And rule number 153. That is application for the license to manufacture Ayurveda, Siddha and Unani medicines. So the application for grant or renewal has to be submitted in the form number 24D to the licensing authority along with the rupees 1000 rupees. 1000 rupees is the fees to be submitted to get a license. So 20 form number 24D. The application has to be submitted in form number 24D. And renewal, when the renewal has to be done, so before the expiry. That we know, if it crosses the expiry date, within 1 month of expiry, you have to renew. Or if it crosses 1 month and if it is within 3 months, you can apply it, for the license for the renewal of the license, but you have to pay 1200 it's additional fee for the purpose. So it is a late fee. So it must be within 3 months after the expiry. And if you loses the license, so you can apply for the duplicate license. So you have to give a 300 rupees fine fee for the purpose. Okay. So that is a duplicate to get the duplicate copy of the license. So application for the license to manufacture Ayurveda, Siddha, Unani medicines has to be done in form number 24D along with the 1000 rupees is the fee. That has been explained in rule number 153. Next one is loan license. What is the purpose of what is the meaning of loan license? So you can see it in the blue colored lines. That is a loan license means a license which a licensing authority may issue to an applicant who does not have his own arrangements for manufacture but intend to avail himself of the manufacturing facilities owned by a licensee in form number 25D. So the loan license means if you do not have a pharmacy or a production setup to produce or manufacture Ayurveda, Siddha and Unani medicine, but you wish to manufacture your own medicine. So you can avail or you can use like a pharmacy who have a license, who have a drug license, drug and cosmetic license, but you can use their provision or their manufacturing setups to manufacture your own medicine. So you can get a loan license. So you are actually getting a loan license. You are actually using their license as a loan. So that is the meaning of loan license. You don't have a pharmacy, but you can use another different pharmacy for manufacturing the medicine. So that is the meaning of loan license. You are actually using someone else's license as a loan. So that provisions has been explained in rule number 153A. So the license has been applied. The loan license has been applied in the form number 24E. Sorry, 25E. Okay, the loan license has to be applied in 25E and the fee of the loan license application is 600 rupees. So if who does not have his own arrangements or his own pharmacy, but you can use someone else's pharmacy or some other pharmacy, but using their license as a loan. So that is the meaning of loan license. Okay, clear. I think it is clear now. So it has to be applied in 25E. Okay. Actually, I'm sorry. Actually, the license has to be applied in the form of 25D. The loan license, the drug license in 24D, loan license in form of 25D. Okay. The form of license to manufacture Ayurveda, Siddha and Unani medicine, that form, the application is granted in the form 25D. So the application is applied in the form 24D and the application is granted in 25D. Okay, and loan license is applied in 24E and it has been granted in 25E. Okay, so that has been a confusion. That is why I told them mistakenly. So the application for the license is applied for in 24D form and it is granted in 25D. And loan license is applied in 24E form and it is granted in 25E. Okay. So the form of loan license, the loan license to manufacture Ayurveda Siddha Unani medicine shall be issued in the form 25E. So it has been applied in 24E. It is issued in 25E. Okay. Next one is certificate of renewal. So this is the certificate of apply. You have to apply that for the license, and you will be issued a license in the form 25D. Okay, and when it is renewed, you will get the renewed license in the form of 26D. Okay. As far as loan license concerned, it will be renewed in 26E. Okay. The rule number 155B is an important one, that is certificate of award of GMP, good manufacturing practices of Ayurveda, Siddha and Unani drugs. Okay. So the certificate of good manufacturing practices to manufacture of Ayurveda, Siddha, Unani shall be issued to licensee who comply with the requirements of good manufacturing practices of Ayurveda, which has been explained in Schedule T. Okay, so only those who had followed the Schedule T will be certified with the GMP certification. The certification, the duration of the certificate is 5 years. So once you get the certificate, that is valid for 5 years. Okay. Duration of license, this is the duration of a GMP and this is the duration of a drug license. So that is also a period of valid for a period of 5 years. Duration of loan license is different. So that is the duration of a license. Duration of loan license is different. That is, it is valid up to 31st December of the year following the year. That is, if the loan license is obtained is renewed in 26E. If the loan license is issued in 25E, it will valid. So if the loan license is issued in 25E in say February 2020, it will be valid till 2021 December. So the 31st December of the following year. So that is the duration of a loan license. So it will be around 2 years, 1.5 to 2 years is the validity. So if you apply the apply for the loan license in 24E, you will be issued a loan license in 25E, and it has to be renewed on the following 31st December. After the before the 31st December of following year in 26E. Okay. Then next is the conditions of the grant or renewal of license in 24D. So that is the conditions that has to be complied before you get the license. So the first one is you have to follow the GMP that has been explained in Schedule T of Drug and Cosmetic Rule. Okay. Next one is no manufacturer shall use any prefix or suffix with the name of Ayurveda, Siddha and Unani medicine, which has been explained in the authoritative textbooks. You have to use the exact name that has been explained in the textbook. Then, the manufacture of Ayurveda, Siddha, Unani medicine shall be conducted under the direct supervision of a competent technical staff consisting of at least one person. So, there has to be one technical staff whole time. Full-time staff has to be there in the manufacturing pharmaceuticals. Okay. So, the qualification of the technical person has been given in the section, that is a degree in Ayurveda or Ayurvedic pharmacy or a diploma in Ayurveda, a graduate in pharmacy or pharmaceutical chemistry or chemistry, botany from a recognized university from central government, or a valid or a Vaidya or Hakim who is registered in the state register of practitioners who have a registration certificate, and a qualification as a pharmacist also. Ayurvedic pharmacist also can be that technical person. So, in a pharmaceutical, as a responsible person, the manufacture of Ayurveda Siddha Unani medicine shall be conducted under the direct supervision of a competent technical staff. So, that competent technical staff can be a graduate of Ayurveda, or the person can have a diploma or a graduate in chemistry, botany, or pharmaceutical chemistry, or a person or a graduate in Ayurveda. A Vaidya or Hakim can also be that technical person, or a pharmacist also. Ayurvedic pharmacist also can supervise the manufacturing in a pharmaceuticals. So there need not be there is no provision, there is no rule that has been explained as a pharmaceutical has to be supervised or managed by a person who have a MD in Dasashastra and Vaishyalpana or Drivyaguna. So any person with the following with these qualifications can manage the as per the rule, they can manage the pharmaceutical production in the pharmacy. Okay. Okay. Then next one is rule number 157A, maintaining the records of raw materials used by the licensed manufacturing unit of Ayurveda. So there has been a performa which has been explained in the Schedule TA. So according to the performa, you have to record. You have to keep a record of raw material usage of the raw materials, and it has to be submitted in the State Drug Licensing Authority of Ayurveda, National Medicinal Plan Board, or any agency nominated by National Medicinal Plan Board. So that has to be submitted by 30th June of the succeeding financial year. So there has to be a record maintained in the raw material section. Okay. Next one is 158, conditions of license. So there has been certain conditions which are mentioned to get the license. So we know that the so the first one is the licensee shall maintain proper records of details of manufacture and of the tests. So there has to be a record to be maintained by batch manufacturing record, as well as the record for the quality analysis also. Next one is licensee shall allow an inspector appointed by appointed under the Act to enter any premises where the manufacture of substances in manufacture occurs. So and licensee shall also maintain an inspection book also. So the inspection book as a form which is mentioned in form number 35. So the inspector can record the impressions after the inspection in this form. Okay. So this is the conditions, the first set of conditions, and the second set is the regulations or the provisions which are related to patent or proprietary medicines under the section 3H. So the section 3H of the Act deals with the patent proprietary medicines of Ayurveda, Siddha and Unani. So as far as that concerned, there has been to issue a license to the medicines with respect to Ayurveda, Siddha, Unani, patent and proprietary medicine. There are certain conditions that are related to safety study and safety and efficacy study. So those criteria or those provisions are explained under here. That is Ayurveda, if the category is Ayurveda medicines which are referred in 158B as referred in 3A. That is, if the proprietary medicine, patent and proprietary medicine is the ingredients are as per the text, or the indication is as per the text, then the safety study is not required because ingredients and the indications are as per the text. But the experience or evidence of effectiveness has to be produced. So the evidence or experience certificate can be produced in two methods, that is published literature or proof of effectiveness. So the published literature is proof of effectiveness is only by the clinical study. Published literature, the literature study has been published in anywhere, any journals. So for the Ayurveda medicines which are been explained, the Ayurveda proprietary medicines, which are in which the ingredients are as per the text and the indication is as per the text, there is no need of safety study. But published literature has to be produced. But proof of effectiveness is also not required. Then, if we do any change in the dosage form of Ayurveda text, so then there are certain differences. That is, if the ingredients are as per the text or indication is as per the text, safety study is not required because ingredients and indication is as per the text, but published literature is required. So, and proof of effectiveness is not required. But if the Ayurveda Siddha Unani medicine are prepared, but it is indicated for a new disease. So, we have to the ingredients are as per the text, but the indication is new. So, safety study is not required since the ingredients are as per the text. But published literature as well as the proof of effectiveness is required because it has been indicated for a new indication, new disease. So proof of effectiveness in that particular disease has to be produced in front of the licensing authority. Next is if the patent and proprietary medicine as per the text. The ingredients are as per the text, but indication is textual rationale. That is, there is a slight difference between the slight variation of the indication. So there is no need of safety study, but published literature of the ingredients has to be produced and a proof of effectiveness has to be produced. A pilot study as per relevant protocol of Ayurveda, Siddha and Unani medicines. Okay. And if the medicine contains any drugs which are included in Schedule E1, the poisonous drugs, then you have to do if it is even if it is the ingredients are used as per the text, you have to do a safety study. Safety study is required. Published literature is required. Proof of effectiveness is also required. So that is only applicable to the drugs which include Schedule E1. The formulations which contains drugs which are included in the Schedule E1, they have to produce a safety study, proof of effectiveness, and published literature. Okay. So these provisions are related to the Ayurvedic classical preparations. But if there is any change in the dosage form or if there is any change in the indication, then you have to produce the published literature. So that is the important one. There is no need of safety study since it has been included in the classical text. But if you are going for a license for the proprietary medicine or patent medicine, if it is indicated in the if it is mentioned and the ingredients are mentioned in the text, then there is no need of safety study. But if the drug contains any drugs which are included in the E1 Schedule E1 of the drug and cosmetic rule, then you have to do a safety study also. Okay. Then next one is the next one is the next important. So these are the important aspects of a rule, and rest of the things that is I only included that is for the knowledge purpose to read. Okay, you have to read those aspects also, but these are the important ones. Okay, then Next is the approval of institutions for carrying out tests on Ayurveda, Siddha and Unani drugs. So the application for grant of approval of testing Ayurveda medicines. So to have a quality control lab, you need to apply separately. You need to apply in form number 47. So these the particulars or the provisions related to the application to carry out the tests in the pharmacy itself, in the pharmaceutical itself, that has been mentioned in the section 160A. The form has to be submitted in 47th form number, and you will issue the approval will be issued in or granted in form number 48. And there have been certain conditions for the approval also. The premises where the tests are carried out shall be well lighted or ventilated, if except where the except in the based on the nature of the test. If the test warrants a dim light, you can have a section for that. But otherwise, the section for the quality control lab has to be well lighted and ventilated, and it should have a minimum space of 800 square feet. And applicant and there should be a separate section for pharmacognosy, Ayurveda, Siddha, Unani medicine, microbiology, sample room, office cum record room. So it all have to be minimum of 800 square feet, and you have to have a separate sections for all these sections, like to keep the records, to keep the samples, to have the microbiology test, to conduct the pharmacognosy test, and to also conduct the chemistry in-process test also. And there should be who does or who conducts the analytic analysis also. So experts such as chemist, botanist, or expert in Ayurveda, Siddha, Unani, or pharmacist who shall possess a degree in chemistry, botany, Ayurveda, or bachelor in pharmacy from a recognized university or equivalent with experience of 2 years for carrying out the tests. So there should be a person with a degree in chemistry, botany, or Ayurveda with the experience of 2 years in conducting the tests. Okay, so these are the important aspects regarding the quality control section. Then we will move on to the duration of approval. So the license duration for conducting the tests. So that is for a period of 3 years. So after 3 years, you have to renew the license. And the next part is the important one, that is part 18. Part 17, which actually deals with the labeling, packing, and limit of alcohol in Ayurveda, Siddha, and Unani drugs. So rule number 161 deals with the labeling and packing and limit of alcohol. So what all should be explained, or what all should be included in a label. So that has been explained in rule number 161. So name of the drug has to be there, and correct and name of the drug and the reference also. The adhikara and reference also has to be mentioned. Reference book has to be mentioned, and correct statement of net contents in terms of weight, measure, or number. So you have to include the content, correct statements of the content with the botanical names of each content with their quantity also. Then name and address of the manufacturer. Fourth one is name of the number of the license. So you have to mention the license number or manufacturing license number, MFG. You will find it in label as MFG, license LIC number, or ML. Date of manufacture and expiry date also. Words like Ayurvedic medicine or Siddha medicine has to be there. And if it is intended for external use, you have to use that term external use only. And if it is intended for medical professionals as a sample, it has to be mentioned as a it is a sample not to be sold. Okay. So these are the minimum things that has to be there in a label. So a true list of all the ingredients with the botanical name and part of the ingredient also, or form of the ingredient, with the exact quantity of each ingredient. And you have to mention the name of the thread with the adhigarana, from which text also. And if it is patent and proprietary medicine, true list of ingredients with the botanical name and quantity, that has to be there. If the medicine contains a lot of ingredients, so and it cannot be included in a label, then it should be enclosed, and then it should be printed separately and enclosed with the packing, and a reference to be made on the label itself. So on the label, you have to mention that ingredients or contents are enclosed in the separate envelope or separate page. Okay, so that has to be included in the packing itself. And if the drug contain any drugs which are explained in the schedule E1, then there has to be words mentioning caution. It has to be used under prescription or under medical supervision. Okay, so the basic things that has to be there is the name of the drug. So name of the drug, below to that you have to mention the adhigara and the text, name of the text also. And for the contents section, you have to mention each two list of the contents with the botanical name and part of the plant also. Then and quantity has to be mentioned. Then apart from these aspects, there has to be name and address of the manufacturer, number of the license, date of manufacture, expiry date, and the words like Ayurvedic, Siddha, and all that has to be there. And if it is intended for external use, you have to mention for external use only. Okay. So these are the things that has to be there in a label. So labeling, packing, and these rules are mentioned in the section 161 of Drug and Cosmetic Act. Okay. There are certain exemptions regarding the labeling and packing. Labeling, like if you are giving a medicine for your own patient, then you don't have to have the drug and cosmetic license also. Then you can give the medicines to the patient by writing the name and address of the manufacturer, name of the drug, and name and address of the manufacturer. That's it. Okay. Next is an important section, that is 161B, that explains the date of expiry. So that has been explained in the Savirida Avadhi class. We have dealt this section in very detail. So the section or the rule number 161B, you can find the date of expiry of Ayurveda formulations. And government analysts and inspectors, that those provisions are explained in part 80. Rule number 162, you can find the duties of inspectors specially authorized to inspect the manufacture of Ayurveda, Siddha, and Unani medicines. So these are the duties of an inspector: to inspect not less than twice a year all the premises licensed for manufacture of Ayurvedic medicines. To send to the controlling authority after each inspection, they have to send a report on the impressions after the inspection. And they can also take the samples of the drugs manufactured on the premises and send to test or analysis in accordance with the rules. To institute the prosecution in respect to violation of any act, like they can, if they find that the rules have been violated, they can also prosecute certain prosecute like confiscate the samples, or to withhold the entire batch also. They can actually prohibit the sale or distribution of the medicines. So they can actually prosecute all those things if they find any violations in the act. Okay. Next question is 162A, qualifications of the State Drug Licensing Authority. So in that you can see that the State Drug Licensing Authority has a qualification, at least 5 years in experience in the Ayurveda, Siddha, Unani drug manufacturing, or in teaching, or in research on clinical practice of Siddha and Siddha, Ayurveda, Siddha and Unani medicine. So 5 years experience has to be there. That can be either in manufacturing, testing, or in teaching or research, in research also. So that is the qualification of State Drug Licensing Authority. Okay. Then you can see the qualifications of the drug inspector also in rule number 167. So in rule number 167, it is mentioned as a degree in Ayurveda, Siddha and Unani medicine, or a degree in Ayurveda pharmacy. They can also be a drug inspector. Next is part 19. Part 19 actually deals with the standards of Ayurveda, Siddha and Unani drugs. So it is mentioned as the drugs including in Ayurvedic Pharmacopoeia of India, the identity, purity, quality test has to be complied with the tests which are mentioned in Ayurvedic Pharmacopoeia of India. And for the asabas and arishtas, the upper limit of the alcohol, self-generated alcohol has to be kept under, or should not exceed 12 percentage. So that has been explained in part 16 of part 19 of drug and cosmetic rule. So these are the important aspects, like from part 16 to part 19 is the important aspects of a drug and cosmetic rule. Okay. So these are the certain important sections, starting from a misbranded drugs. That is 33E. 33EE is adulterated drug. 33EEA is spurious drug. So all those part, the sections are actually needed only for a entrance purpose, but to write an essay in 5 mark or a 10 mark, you can actually write a certain uh, details with regards to the license and conditions of license, drug inspector, drug analyst. So these are the important aspects of a Drug and Cosmetic Act 1940 and Drug and Cosmetic Rule 1945. Now we will move on to good manufacturing practices, which has been detailedly explained in Schedule T of Drug and Cosmetic Rule. Okay. So good manufacturing practices. So in this okay. In this PPT, you can find introduction to good manufacturing practices and what is the importance of GMP and what is CGMP and why it is needed and the objectives of GMP. And Schedule T of GMP will be dealt in detail and there will be a conclusion also. So these are the contents of the PPT. And coming to the introduction, we know that each and every day the herbal medicine, the usage of herbal medicine is increasing, and so the demand and so the production. So, it is important to have a regulation or a regulation that will consolidate our market in the global, our consolidate our standards. There should be a guidelines to maintain a minimum standards so that we can consolidate our position in the global market. Okay. So for the purpose of maintaining a standard, the authority have set a guidelines that should be followed in the pharmaceuticals. So good manufacturing practices is a production and testing practice that helps to ensure a quality product. So it is a production and testing practice. So these are like set of guidelines. GMP guidelines are not prescriptive instructions on how to manufacture product. Like In GMP, you cannot find a preparation of thyla or preparation of avaleha and all, but it will describe, or it will give you a guidelines how to do a how to prepare the medicines in a proper manner, which will decrease the risk in any production unit. So these are a set of guidelines which will decrease the risk in any pharmaceuticals. So these are not a description or not a prescriptive instructions on how to produce a drug. These are a production and testing practice that should be followed in any manufacturing premises. So these are as general principles that must be observed during the manufacture, not on the manufacturing, during the manufacture. So the regulation, coming to the regulations, the GMP, the rules for GMP for Ayurveda Siddha Unani medicine comes into force from 23rd June 2000. The provisions which are related to ASU has been included in the Drug and Cosmetic Act during 1962, but GMP has been, the Schedule T has been incorporated only during 2000. And in drug and cosmetic rules, you can find the GMP provisions regarding the GMP in the section rule number 155B. And GMP certificate is issued in the form 26E1 and the validity is for 5 years. And GMP is detailed in Schedule T of Drug and Cosmetic Act. So these are the regulations of GMP. So as I mentioned, GMP is not a GMP will not instruct you to how to produce a drug. No, like Thailam and all the proportion and all that will not comes under the purview of GMP. GMP is a set of guidelines which are designed to minimize the risk which is involved in any pharmaceutical pharmaceutical manufacturing company that cannot be eliminated through the testing the final product. So GMP covers all the aspects of production, like from the raw materials, selection of the raw materials, and the storage of raw material, and equipments that has to be used in the production, and the maintenance of the equipments, and the workers and the personal hygiene of the staff, and the work safety of the staff. All those will comes under GMP. Okay, that is a good manufacturing practices. So, as per WHO, it has been mentioned as the part of quality assurance that ensures that the products are consistently produced and controlled to the quality standards appropriate to their intended use and as required by the marketing authorization. So, it is to ensure the products are consistently produced as per the standards. So, this is the importance of GMP. Okay. Next, why the GMP is important? So we know that as per the government requirement, and which ensures the quality product, the poor quality drug or substandard drug will cause the ill health or the causes various ill health in the customers. So to ensure the quality product, to maintain the manufacturing consistency also. So if you prepare the drug today, you have to you have to prepare the medicine. The same final product has to be obtained if you do it in the second time also. So for the purpose of consistency, you have to follow the GMP. And for customer satisfaction, so if you consistently produce the medicine, the customers will be happy. And to reduce the rejection and recalls, and company to secure the company image and reputation. And if this all happens, it will boost the pharmaceutical export opportunities also for the Ayurveda medicines. 10 golden rules of GMP. So there are certain rules has to be followed. These are not mentioned in GMP of Schedule T, but as a guideline, you can use these golden rules when you are working in a production company. So get the facility design right from the beginning itself. So you have to form a design from the right from the beginning itself. Then you can follow it consistently and validate each process and follow also. and write good procedures and follow those procedures. Make sure that you follow the procedures and identify who does who. So you have to have a knowledge of the persons who are working in each sections and who does what. Okay, and keep good records. So you have to maintain different kinds of records: batch manufacturing records, master formula record, quality control record, raw material record. So you have to keep the records and train and develop staff. You have to give continuously. You have to give training to the staff to improve the efficiency in their work, and practice good hygiene and maintain facilities and equipment and build quality into the whole product life cycle. So from the you have to start from the raw material selection till it has been moved to the product has been moved to the finished good stock. So you have to build a quality in the whole product life cycle and perform regular audits also. So these are the 10 golden rules of GMP. And what is CGMP? So CGMP stands for current GMP. So that indicate that requiring the companies to use technologies and systems that are up to date in order to comply with the regulations. So that is a CGMP, current GMP. Next is the objectives of GMP. There are 4 objectives of GMP. First one is the raw materials used in the manufacture of drugs are authentic, of prescribed quality, and are free from contamination. Second is the manufacturing process has been followed to maintain standards. So there has been an SOP to each to manufacture each drug, and adequate quality control measures are adopted. So there has to be an in-process quality control analysis, and after there has been a raw material quality control analysis, and finished product in-process quality control analysis, as well as the final finished product has to be go through a strict quality control analysis. Okay. So the fourth one is the manufactured drug which is released for the sale is of acceptable quality. So these are the 4 main objectives of GMP. Next is the GMP schedule. The schedule T is exempted for the Vaidyas or Hakims who are preparing the medicines to dispense to their own patients, not as a bulk. The GMP and the Drug and Cosmetic Act and rules are applicable to only those who are preparing the Ayurvedic medicines in a large scale. So for the small scale purposes, for the purpose of dispense to their own patient, the GMP and the sections included in the GMP are exempted. Okay. Then GMP has 2 parts. That is, part 1 is factory premises and general requirements are explained in part 1. And part 2, you can find list of recommended machineries, equipments, and minimum manufacturing space required in the pharmacies. So that you will get in part 2. Part 1 is general instructions on the factory premises and all the general guidelines you can find it in part 1. Next, so we will move on to part 1 first. So factory premises. So the manufacturing unit must have adequate space for receiving and storing raw materials, manufacturing process areas, quality control section, finished goods store, office and rejected goods or drug store. So first, the raw material section you have to have a space for storing and receiving raw material, manufacturing process area, and quality control section, and finished product section, rejected goods stores, and you have to have a office space also. So general guidelines, general requirements that will rules or guidelines will be related to location, building, workspace, water supply, container cleaning, stores that can be raw material store, packing area, finished goods store, waste disposal, workers, and hygiene of workers, machineries, maintaining records, and quality control. So these are the general requirements. The general requirements on each and every sessions are explained in GMP. The location and surrounding. The first general requirement is regarding the location and surrounding. So it must be the location of the pharmacy must be away from the sewage, drain or public lavatory, public bathrooms and all, and any factory which produces disagreeable or obnoxious odor or fumes. So the location has to be clean and it must be away from sewage and all. So that is the general guidelines regarding the location. And building has to be the main processing plant should have an access to raw material store, powdering section, and quality control section. So the idea behind a effortless or a easy manufacturing is there has to be a flow in every aspect of the manufacturing. So first, the medicine, the raw materials are collected in the raw material section. So then there has to be have a connection or a have a access to the powdering section. So they can actually move the big logs of medicine, big logs of Devadaru and Ekthirindana to the chopper section. They can where they can chop all these drugs, and there they from there they can directly move the drugs to the churna section, the powdering section, and then there can be a separate section where they can keep the pulverizer disintegrator separately, so they can manufacture kashaya churnams in disintegrator and other fine powders in the pulverizers that can be and then there has to be provision for separate powdering session also for the purpose of praksheva churnas, preparing praksheva churnas, kalkams. There has to be have separate session in the powdering session. So there won't be any disruption or interruption in the manufacturing process. So and after that, the main manufacturing area has to have a access to every other sections like a juice, herbal juicer section, and Guliga section. So you can transfer the cultural Gugulu preparations in the main plant from the main plant to the Guliga sections directly. So and the raw materials has to be raw material section has to be, have a access to main plant. So there won't be any interruptions in the transferring the raw materials to the main processing area. So the idea behind this is there has to have a flow in each and every process. So that is regarding the building, the plan of building, and light and ventilation. Regarding the light and ventilation, the buildings has to be properly lighted and ventilated. And regarding the floor and wall, the floor and wall has to be should not be damp or moist, and the flooring, the floor should be smooth and even, so that it will prevent or prevent the retention or accumulation of dust or waste products, and provided with the proper drainage system in the processing area. So the processing area will be continuously cleaned and washed with water. So there has to have a proper drainage system that has to be there in the processing area. The next one is the working space. So adequately provided with the working space to avoid risk of mix-up or cross-contamination of the ingredients, as well as a safety working atmosphere, to provide a safety working atmosphere to the employees also. And designed, constructed and maintained to prevent entry of insects or rodents. The furnace and bhatti section could be covered with a tin roof and proper ventilation, but sufficient care should be taken to prevent flies and dust. Okay. Water supply, regarding the water supply should be pure and potable quality, and adequate provision of water for washing the premises shall be made. Disposal of waste. So after suitable treatment, so pre-treatment of the waste has to be done before you dispose the waste. So that is as per the pollution control authority, pollution control detail provisions. For the purpose of containers cleaning, there has to be a separate space has to be there for container cleaning, and for the drying purpose also there has to have a separate space. Raw materials. So we know that there are 8 kind of raw materials are used in the manufacture of Ayurveda drugs. Raw materials of metallic origin, mineral origin, animal source, fresh herbs, dry herbs or plant parts, excipients, volatile oils, perfumes and flavors, plant concentrates, extract, exudates, resins or preservatives. All these are considered as raw materials. So these raw materials, these separate raw materials has to be kept in separate containers which has to be labeled properly. So in the label, you have to mention name of the drug or name of the particular raw material, source of supply, and you have to mention the date also. So then you can follow the first come first out rule. So first received raw material has to be used first. So that has to be followed. That rule has to be followed. So source of supply and date has to be mentioned, and status of raw materials like under test, approved and rejected. That has to be mentioned. So these are the these are the guidelines regarding the raw material section. And regarding the finished goods stores, after we finishing up preparing the medicines, you will transfer the medicines to the packing session. After this has been packed and they recorded in the packing session, how much quantity, how much numbers of the containers have or medicines have packed, you have to transfer this entire block of the medicines to the finished goods stores, where you have to keep these medicines in a section known as quarantine. So that means that these finished products are under test. So after the quality control analysis only, you can transfer these medicines from the quarantine sections to the finished goods store. So that is the finished goods stores guideline. And in the finished goods stores also, you have to maintain a record. How much quantity you received from the packing session. And next one is health, clothing, sanitation, and hygiene of workers. So the workers has to be free from contagious diseases, and proper uniform, which is suitable for the nature of the work, that has to be used. That has to be used by the employees. And cloth and synthetic covering for the hands, gloves can be used as per the duty, as per the work. And adequate facilities for personal cleanliness, such as clean towels, soap, scrubbing brushes has to be provided to the employees. Medical services. So the employees must be done a health checkup when they are before they are being employed in the pharmacy, and after that every year once there has to be a medical checkup for every employee to make sure that the employees are free from contagious disease or any other illnesses. And there should be a records for every aspect. You should maintain a record, so that they can be followed in the next step. So that is the importance of maintaining a proper record. And machinery and equipment. So depending on the quantity of the drug, the batch size, the nature of the product, the each and every section will have a machinery. So there has to have a proper SOP for cleaning of machinery and maintenance of the machinery also. And vacuum or wet cleaning methods are preferred in pharmacies, and non-wooden equipments has to be used whenever it is possible. If the traditional process warrants the wooden material, you can use the wooden material. Otherwise, you have to use a non-wooden equipment like stainless steel material has to be used. That in the currently in the pharmacies, you can see the stainless steel machineries for entire purpose. Next is batch manufacturing record. So that is an important one. So you need to, every batch of Ayurvedic drug production, there has to maintain a batch manufacturing record, BMR. So these records has to be duly signed by the production manager or quality control analyst. So in manufacturing record, you will find the details regarding the issue of the mix or issue of the master formula to the raw material section, and the mix has been issued, the date of mix issued from the raw material section, and when the process has started, when the pre-process has started, when the process has started, when it is finished, when it is transferred to the packing section, and how much quantity is transferred to the packing section, how much bottles has been received, how much bottles has been packed, and how much it has been transferred to the finished goods store. So all these informations you will get from the batch manufacturing record, BMR. so that you can find out where any disparity or any delay in process or any delay in issuing the mix from the raw material section, or any delay in the preparing, or any delay in the manufacturing. So all these can be understood by looking at the manufacturing, batch manufacturing record. And there is another record, that is distribution record, that has to be maintained in the FG store, that is finished goods store, to find out the distribution areas. So if you have to do a recall, that will be easy if you keep a distribution record. And the distribution records has to be kept for until the date of expiry of each batch. For Basma and Dasa preparations, you can keep up to 5 years. And record of market complaints also has to be kept. So once in a period of 6 months, the manufacturer has to produce these market complaint record to the licensing authority once in 6 months. Next is quality control section. So one person with a degree in ASU, that is Ayurveda, Siddha, Unani, Bachelor of Pharmacy, Chemistry, Pharmacognosy. Those can be the head of the quality control section. And the duties are to test the raw material, the monitor in process manufacturing of Ayurveda, Siddha, Unani medicine, quality control of each Ayurveda medicine after the preparation. And there should be a space of 150 square feet for the quality control section in the production plant. And it is for identification of raw material, reference book, reference sample has to be maintained. So raw material reference sample has to be maintained. The finished product reference samples has to be maintained. So finished product has to be maintained up until their expiry date. After that, you can discard the samples. And so these are the part 1 of GMP, food manufacturing practices. Coming to the part 2, there you can find minimum space which are required for each and every process. Adequate and orderly placement of equipments and materials has to be done. So list of equipments and machineries that has to be there in the pharmacy, you can find it in the part 2. And minimum space. So for almost all the procedures, for almost all the procedures, 100 square feet is the minimum space required. Like Anjana, for preparing Anjana, body, Udiga section. Udiga section, 100 square feet is necessary. Minimum of 100 square feet. So you can, based on the manufacturing, based on the quantity, you can have a you can actually assign, or you can actually plan accordingly. But minimum of 100 square feet has to be there in a Guliga section, Dehya section, Anjana section, and almost all the procedures. But except Churna, Nasya, Lepa, Kwada Churna, Asava, and Arishta sections, each section has to be 200 square feet. And for Puvipaku Rasayana, Shara, Parpadi, Lavana, Bhasma, Bhatti area, you need to have 150 square feet each section. And a minimum of space required for manufacturing area, a whole area has to be minimum of 1,200 square feet. So that is the minimum space required for the production of for getting a license of for producing or manufacturing ASU medicines. And there is a supplementary guidelines are also mentioned in the part 2 for manufacturing of resaushadis. So in which you can see that bhatti or heating devices, there has to be a separate space of 100 square feet, and grinding, bhavana, all those process has to be, that is related to resaushadi, 100 square feet has to be there. Resaushadi related store, that has to be 100 square feet. So all these supplementary guidelines are mentioned in the part 2. And you can find there has to maintain a separate register for Resaushadi, like Shodhana register, Bhavana Puda register for Marana, for Basmigarana. So in Shodhana register, you can find that serial number, batch number and size, date, time and duration, name of the raw material with quality, reference and quantity, and the quantity of Shodhana Dravya, reference book followed, and methodology. So by this you can follow the procedure later on also. So this is the which is explained in the part 2 of GMP. And list of important documents in the GMP, that is policies, certain policies, standard operating procedures in each sections, specifications that has to be followed in each sections, and a master formula record, that is the formula record, mixture or a formulation record, and BMR, batch manufacturing record, manuals, like Ayurvedic Pharmacopoeia of India, like manuals, and master plans or files, validation protocols, forms and formats related to production, and different records like BMR record, distribution record, records of marker complaints, and ADR. So these are the important documents in a good manufacturing practices. And so there ends the parts related to good manufacturing practices. And these are the important forms which are related to Drug and Cosmetic Act. That is 24D is application for grant or renewal of license. 24E is application of grant or renewal of a loan license. 25D is license to manufacture, issue license in 25D, and issue loan license in 25E, and certificate of renewal in 26D, certificate of renewal of loan license is 26E, form of certificate of GMP is 26E1, and application for grant or renewal of carrying tests on Ayurveda Siddha Unani drugs is form 47. And as I mentioned earlier, there has to have a record in the raw material section to note down, to record the usage of the raw materials. So that has been issued included in the Schedule TA. So form for record of utilization of raw materials by Ayurveda Siddha Unani licensed manufacturing units during the financial year. So this is the performer of the form. Okay. So there ends the sections, the class regarding the Drug and Cosmetic Act and Rule. In this class, we have detailedly explained about the provisions which are related to the Ayurveda Siddha Unani medicines in the Drug and Cosmetic Act. Certain sections we have covered, and the GMP, so good manufacturing practices sections are also covered. Okay. Thank you for patient listening, and we will meet in the next class. Okay. Thank you.